Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. We have been joined in studio by Minister of Health and Wellness, Michel Chebat, and we're about to embark on an extensive conversation about COVID-19, which includes topics such as the latest figures, as well as a detailed breakdown of the latest or most recent statutory instrument that has come into force. That being said, good morning, Minister Chebat.
Good morning, Isani. Good morning, Marlene. Thanks for having me. Good morning, Belize. And as usual, a special good morning to the good folks in Kaya North.
All right. Where are we in terms of numbers as of Friday? I know that the numbers for Saturday and Sunday will be released sometime today.
Right.
But in terms of the overall picture, what are we looking at as of Friday?
Yeah. So, Marlene and Isani, the situation continues to be very worrisome. Up to Friday, we had 228 new cases. We have still continued to have a daily positivity rate of 12.5%. And the positivity rate is very simple. It is the rate of transmission. And that is derived by the number of total tests that are done over the amount of positive tests. And so it shows you how the virus is being transmitted. The research, the learning is that once the virus is over, the positivity rate is over 5%, it means it is a widespread, you don't have control of it. And so the target is to keep it at 5% and below, and once you reach that over a 2-week period of time, that is an indication that there is some control over the virus. So that is where we are in terms of positive cases. I believe we had 4 deaths on Friday, all unvaccinated persons, and we had 48 hospitalizations as well on Friday. Today we're going to get the numbers for the weekend and for today. Yeah. So still continues to be a very worrisome situation. And I think, we have long thought about COVID in Belize to be a pandemic of the elderly. We've always thought, boy, the younger people are not affected, but I think more and more what we're seeing with this Delta variant, that not only are the elderly being affected, but people in their 30s and 40s. And especially, I think we always are concerned when we started talking about schools and the reopening of schools, we were concerned that the kids would take the virus home and would affect the elderly. But we also have to stop and think about the people in this country. We have 60% poverty rate in this country. And there are many people in this country who are not able to afford to buy proper food and nutrition and medicine and medication. And so this is really a pandemic of everybody, especially the poor people in this country. And so we really need to stop and look at that and be concerned about the spread of this virus.
When you look at what was put in place several weeks ago, which included a 7 p.m. curfew, as well as 2 no movement Sundays over the course of a 2-week period, I am assuming that by now we should be looking forward to see what effect, if any, that has on the overall spread and total number of active cases. Yeah. Can you speak to us on that?
Yeah. So we had decided that we were going to move the curfew to the 7 p.m. That was at the height of the spread of this virus. In the flu clinics in September, we were seeing that anywhere between 50 to 60% of the people coming in were testing positive. My latest discussion with the doctors there indicated to me that that is now down to between 30 and 35%. And so we're seeing some marginal differences. Part of the difficulty of this pandemic is that it is so hard to predict what is coming next. And so as we go along, we try different formula. We know that this pandemic is spread by human behavior. And when we move the curfew from 9 to 7, people complain, why are you doing this? This pandemic doesn't spread at night. Things like that. People complain about this. But the fact of the matter is that it is after that 5 o'clock hour that people lose lessen up their guard, so to speak. This is when people go out and socialize and start to drink. and this is what we were seeing.
Yeah.
And so it was critical for us to try to lessen the time of where the opportunity for people to interact. You don't see the immediate effect of it. It is down the road. It is 2 weeks later. It is 3 weeks later that you start seeing the effect of the measures that you put in place. And we're now seeing this.
That's why I was going to say today's numbers are going to be critical, and this week people, we have been told by yourself, by ministry officials and by the Prime Minister that the expectation is that that 2-week restricted movement should have an implication around this time.
Right. Well, Marlene, we are hoping that critically by the end of the month, we're going to see a significant reduction in the number of positive cases. The equations we're running through the EPI unit at the Ministry of Health and Wellness, when they put in all of the variables, the indication coming out from them is that we should see a spike by the end of the month and cases starting to decline. Now,
so we haven't peaked yet?
We have not peaked yet. We have not peaked yet. We are expecting that this peak will come at the end of the month, and then we're going to gradually seeing cases decline. I want to say this very clearly. There is no magic formula for this pandemic. The basic knowledge is that it is spread through human interaction. And so what we do, how we behave, will determine what the result at the end of the day will be. People are tired of hearing, wear your mask, social distance, wash your hands, but they continue to be the best tools we have to combat this virus. Look at the vaccine. You know, in Belize, the anti-vaxxers have had a very loud voice. But I think we have reached an incredible milestone in this country. We started vaccinating, I believe it was in April when we March or April when we got our first 1,000 vaccinations. We're now up to 203,000 persons who have at least one vaccination. We have 163,000 who are fully vaccinated. That is a major, major accomplishment. There are people in this region who don't have access to vaccines. Here in Belize, we are fortunate that we've had a menu of vaccines to choose from. And so I think we need to stop and look at that. That is an incredible accomplishment. It is not yet where we want to be. There's still so much work to be done in terms of getting people vaccinated. But
and I want to get into that very briefly, but before we do, let's come back to the restricted measures. I want to ask you, you know, this administration campaigned and came into office with the mandate of being able to address the pandemic. And one of the things was said was that you were going to trust the science. Minister, was it your recommendation to only do the restricted movements for 2 weeks, or did you hope that it would be approved for longer?
Well, Marlene, the way this works is there is a team of doctors who advises me, and I take these recommendations to cabinet. I think it is important for people to understand that these decisions, that COVID, first of all, is a national issue. It is not a Ministry of Health issue. It is a national issue. And the decisions that are made are cabinet decisions. It's not the Minister of Health and Wellness, although he is the face of the ministry and he speaks on behalf of the ministry. The fact of the matter is that this is a national issue, and these decisions are made collectively around cabinet.
But surely you put forward recommendations.
Of course.
We heard from Dr. Diaz, for example, saying longer would have been better, but because the idea is we need to cut down on the spread that we're seeing.
Right, right. So it is a common fact that the recommendations are made and cabinet discusses the recommendations, and they, in our better judgment, in our best judgment, we try to make the right decisions and adopt the recommendations that we feel will work. In cabinet, it is difficult to just look at one issue. We need to have a balance. And so we need to always strike a balance between health and economy. And so while sometimes the doctors want to go really, really, really hard, there has to be a balance. We have to look at everything else and come up with what we believe is the best decision based on the recommendations that are being made.
But that's a delicate balance to strike.
But did you want it longer, though, than 2 weeks? Personally, as the representative of the Ministry of Health in this country?
I believe it should have been longer. I believe that there was a time in September where we needed to have more stronger measures in place, because it is proven, if we step back a little bit, when we came into office between December and January, we had some very stringent public health measures in place. We saw the numbers go right down. they went right down March, April, May. It was until the appearance of this Delta variant that we saw an explosion, and we are now going through a third wave. But I think if you look at what has happened, if you look at the history of what has happened, the more stringent measures you have, the more control you have over the spread of the virus. And I'll tell you, it has not been easy. It has not been easy as a Ministry of Health, because these are complicated issues, and the work that goes behind the scenes is not frequently seen, you know, is not frequently seen. And beyond that, the sacrifices that the nurses and doctors have made in this country, I mean, these people are just incredible, because despite all the challenges that they face, they go back there day after day and they give you the best that they can give. And I don't think that we can sing their praises too often enough.
I'm saying that it's perhaps quite a difficult balance to strike when you're looking at a government whose mandate in equal parts is economic recovery, but you're in the face of a public health crisis where the very same people who are the actors, if I may, to help return the economy to where it was, are the very same people who are directly affected by this virus. When you, as the Minister of Health and Wellness, approach your cabinet colleagues with certain recommendations that come from your team of advisors, and to have it either outvoted or to say, you know what, let's lean more in favor of trying to get back this particular industry versus the fact that, you know what, there's a spike in the number of active cases. How do you walk away from a conversation or from a proposal that gets either shot down or it gets kind of tweaked to favor one aspect of it?
Like I said, Isani, it's not an easy balance, but there must be a balance. Remember, we are coming from an economy that was devastated. We're coming out of a 60% poverty rate in this country. We need to stop and look to see how we're going to get food back into the plates of these people, of our people. And so, while as the Minister of Health and Wellness, I want to go 100%, sometimes I want to go 150%, and my colleagues don't always see it the way I see it. It is understandable, because if we only focus on one thing, if we only focus on health, what then happens to the population? How will they find jobs? How will they feed their children? How will they send their children to school? And so there is always that balance that must be struck. The economy must be brought back. We need to get people back to work. And I think it is important for people to understand that they must take personal responsibility for this virus. That is what it comes down to at the end of the day, Sani. As a government, we can put in all the measures in place, short of locking down this country. But if people do not adhere, if we have the police weekend after weekend breaking up parties, you know, if people are not adhering, if people don't stop and look at what they must do to help to curb the spread of this virus, then we are in a difficult position. You know, where do we go? Do we want to go down to a lockdown? Is that what we want? I don't think that's what we want.
By all indications, that seems to be completely off the table for this administration.
Marlene, I think it is critical to look at the number of vaccinated people we have. And I can tell you that as that number increases, the likelihood of a full shutdown is nowhere around the table, so to speak.
Let's take a look at the breakdown of vaccinations so far. I sent an image it was presented in the, recently in the Ministry of Health's educational forum. So we're looking at the number of people who are fully vaccinated based on specific sectors.
Right.
The tourism sector, for example, is at 100% with at least first dose. Customs as well. Those two particular sectors should be lauded for those efforts there.
Absolutely.
And then we have other areas, other vulnerable groups who have not been able to showcase promising numbers.
Right.
Public servants, for example, still very low. We have some of the special conditions, that's also very low. I know you know the numbers. I'm only saying it for the viewers while we get
Sure.
the image up. But
Sure.
tell me your feedback there.
Yeah. So again, Marlene, we have in your face everyday campaign about getting vaccinations. As you know, one of the measures we've recently implemented is that for you to work or for you to access a public building, you must be vaccinated in the first instance. We are still allowing people to come and present as an alternative, a negative antigen or PCR test. But I can tell you that, again, it goes back to personal responsibility. As a government, we have done everything we could to get the vaccine in country, and we have done everything we can to make the vaccine accessible to everyone across this country. Now, short of going house to house and jabbing people against their will, it is virtually impossible. It must be the person taking the initiative, understanding the importance of the vaccine, and wanting to get vaccinated.
That brings me to this other, to kind of go back to where we began from, where you were mentioning the anti-vaxxers. Now, if you're juxtaposing where we are in terms of the number of persons who have been either fully inoculated or persons with at least one shot so far, versus the campaign that is being led by those who are in stark opposition of getting vaccinated, how would you describe that picture?
Well, I think Isani, the numbers speak for themselves. Having 163,000 people fully vaccinated is quite an accomplishment. And it shows you that while these people may be loud on social media, the fact of the matter is that the majority of the population are understanding the importance of the vaccine and are getting vaccinated. To have 163,000 people fully vaccinated is an accomplishment.
Some would argue nonetheless that it's less it's less than half of the actual population. If we're estimating that we're at 400,000 or so people, while we set aside the very young who cannot be vaccinated at this point, one could say, well, 163,000 represents less than half of the actual population that we're targeting.
Yeah, I mean, Isani, you can look at your glass being half full or half empty. But I think in 7 months, having 163,000 people vaccinated, you can't easily dismiss that number, and you can't dismiss the implication of it, which is that people are listening, people are understanding. When you look at the amount of people dying in this country from COVID, and you realize that, again, I heard you this morning speak about Colin Powell. We've had breakthrough instances here in this country where we've had fully vaccinated people die. But when you look at their medical history, you see obesity as a common factor. You see diabetes as a common factor. You see hypertension as a common factor. And so at the end of the day, like I said before, there are no silver weapons. There's no one solution. But the vaccine gives you a fighting chance. The vaccine gives you that of an additional defense against this virus. And I think critically people are starting to understand that.
And that's why I wanted to come back to the population group. When we look at the specific area of comorbidities and special conditions and obesity, they're very low. Is there going to be a targeted campaign to get these persons vaccinated? The number of persons who have comorbidities, 37% have received the first shot, 16% has 2 vaccines. Obesity, disabilities, is 35 and 14 fully vaccinated. Special conditions, 12.5 and only 1.7 fully vaccinated.
Yeah, Marlene, clearly, I think in addition to vaccination and to a targeted vaccination campaign, I can tell you what we've started to do is we've reached out to all of our area representatives, including the opposition area representatives, in an effort to work with the Ministry of Health so that we can use their machinery to help us to go into their constituencies to start vaccinating. Last week, Saturday, we did it in Fort George. This week, we're going to be doing it in Corozal Bay and also in Pickstock. And so it is an additional way that the Ministry of Health is reaching out, trying to find alternative ways, non-traditional ways of reaching our people who wish to be vaccinated and bringing it to their doorstep, so to speak. But I think, Marlene, we have been, let me say it this way, for the past 11 months, we have been so focused from the Ministry of Health and Wellness on COVID. But I think it is time that we start looking at all of the other diseases that plague our population. And among those, obesity is one, diabetes is a major one, hypertension is another one. This week, we are looking is our Cancer Awareness Weeks. Today, the week starts. And so cancer is also a factor that is affecting our population. And so as a Ministry of Health now, as the weeks go by, you're going to see that our shift, there's going to be a shift in our direction, and we're going to be looking at what are called the NCDs and how we can go back. We're going to be looking at our primary healthcare system and how we can go back to the foundation of healthcare in this country. So in the next couple of weeks, you should be seeing a shift in the focus of the Ministry of Health and Wellness.
Now, clearly, that can help if people have their conditions under control and they do confront COVID-19, they'll be in a better position.
Yes.
But let's come back to what is the biggest issue, I think, right now for people. Vaccinations was seen very early on as the way out of this pandemic. Unfortunately, with the Delta variant and the rapid spread, it's not the case. It is now an added layer of protection that we have. Now, let's talk about the situation of breakthrough infections in Belize. How are you monitoring? What research is being done to understand more why persons who are fully vaccinated are ending up hospitalized or losing their lives?
Yeah, so Marlene, this is something we are watching very closely. The data is being gathered. Our EPI unit is looking at it to try to determine what are the common factors among these people. We also share our data with PAHO and WHO, who help us to do analysis and to look at situation studies. And so that all this information is being shared, all of this information is being looked at, and we're hoping that very shortly we're going to have some report as to what is causing, what are we seeing, and how can we tackle this? How can we tackle this? I think, Marlene, I don't think that I would want us to walk away from this conversation with the notion that the vaccine is not the best defense. It really is. I don't think there's anything that can guarantee you from dying. There's so many other things. But in relation to COVID, the vaccine remains the best weapon we have. It gives you the best chances to survive this pandemic. And so I want that to remain the clear message of this conversation this morning.
Well, I did want to come back to what the numbers were saying, because where I want us to dive just a bit deeper into breakthrough infections, it is very clear that unvaccinated persons make up the majority of hospitalizations and the majority of deaths.
Absolutely.
That's the fact.
Absolutely.
But I think the concern that comes for people who've taken the initiative to get fully vaccinated is, well, why is this happening? How concerned should I be? I'm fully vaccinated. Should I be, I'm continuing with all my protocols, but what are my risk factors now?
Yeah. Marlene, I think that it is clear that even if you're vaccinated, people who have comorbidities really have to continue maintaining their guard. You have to continue wearing the mask. You have to continue social distance. You have to continue with proper hygiene, hand washing. As we have seen with these cases, as I said earlier, when you look at the common factor among people who have these breakthrough infections and who are dying in Belize, there are 4 common features: obesity, hypertension, diabetes, and cancer. And so if you know you have one of those conditions, then the burden is upon you to make sure that you're adhering strictly to the other public health measures that will give you a chance. Make sure you're not gathering, so to speak. And so, listen, it's not easy. It's not easy. Each of us must continue to maintain our safeguard, to make sure we're adhering to the public health measures. It comes down to that. It's human behavior, simply human behavior. As simple, I know that we want to have some complicated answer or some complicated solution.
Yeah.
But at the end of the day, it's really a simple solution, you know. It really is.
Well, we do have a very complicated solution. That's the new regulations that are coming out. And there's a lot of, this is where we see, in effect, the balance between being able to allow the business community or livelihoods to be maintained, as well as maintaining life.
Of course.
And the risk of COVID-19. But the core issue, before we even get into the details, is the one you started off with, where you said police is still breaking up parties. Minister, enforcement still is a major issue in maintaining COVID regulations. The best statutory instruments can be put in place, outlined with, checking vaccination card status, number of persons, but how do we enforce?
Yeah. Enforcement continues to be a challenge, Marlene. Undoubtedly, at one of our recent cabinet meetings, we have decided that we're going to implement a COVID enforcement task force, and so that we're going to be deploying about 145 persons across this country whose task is going to be particularly to go around and to check and to make sure that people and businesses are adhering to the COVID measures. We expect that this team will be on the ground by the 1st of November.
Who are these
of this year.
persons?
These are people who we're going to be gathering from the community, identifying.
They'll apply for jobs or
They're
volunteers?
going to be applying for jobs. It's going to be employment. And so we are expecting that we are going to employ 145 persons who are going to be throughout the country, who are going to help us with the enforcement. I think we need a team that is more sensitive, a team that is particularized, a team that understands that their task is to really get out there and perhaps in the first instance to help to educate people about what the measures are and about the importance of adhering to them. And surely those who are in violations will be ticketed.
Will they have authority to ticket?
They will have authority to
So they're like special constables?
Exactly, but attached to the Ministry of Health and Wellness.
Okay, so here's a question with regards to that. What training, if any, will be afforded to these individuals prior to them assuming that job?
Right. So we're training them. The police will be doing training for us. We've spoken to the Commissioner of Police, so they're going to be doing some training. And also they're going to be trained by our public health inspectors in relation to the public health measures, what they are and what they should be looking for. So the training will come from both ends, from the Ministry of Health and Wellness in terms of the measures, and also from the police.
So there'll be an sensitization process with the communities that they work. They'll be stationed in the communities?
They'll be stationed in the communities.
Okay. So there'll be a sensitization process, then they will be allowed to ticket if they see infractions.
That is correct.
Is there a warning system in place, or once you've been sensitized, you are subjected to?
Well, we want there to be a warning system in place. We feel that it is necessary in some instances, depending how egregious the breach is, for people to be warned. I mean, we don't want that if we see somebody walking with the mask below their nose that they be ticketed. What we want is somebody who is conscious of what it is and to go and approach the person and express to the person the need to properly wear their mask. That would be a first warning. On your second violation, then you must expect that you'll be ticketed.
What's the qualification for these persons? Because we know, let's be honest, in Belize, when people want to get away with things, they find a way.
Well, Marlene, there's no foolproof system. And if we want to look at what the negatives are that can arise, then we're not going to go anywhere. We are hoping that we'll be able to attract people of integrity, primarily. And we want to attract people who have at least a high school education, a high school diploma, who can have some basic understanding, and who can talk to people, who have the ability, public relations, who can relate to people. We don't want people there who are going to be overly aggressive and so on. We want people who can be trained, given some lessons in public relations. I think education is key here. Education is key here, and we don't want to create a parallel police force. That's not what we want. We want a team of people who can go out there, who can share information, who can help us to educate the public. And on a second and third try, then we enforce the law.
I'm assuming that these individuals would be readily identifiable based on perhaps a uniform or something that stands out for us to be able to say, okay, this is the individual who's a member of the task force.
Right. So what we're going to do is we're getting vests for them that will clearly identify them as being part of the COVID enforcement task team, so that once you see them, you know exactly who they are. And they're also going to have identification badges, so that if you need to know the person's name, you'll be readily seen with a picture of that person.
Okay.
Right.
So it's like a tourism police unit, but it'll be a COVID enforcement.
COVID enforcement task team.
Okay.
Yes.
And where are the funds coming from this?
Well, these are funds that Cabinet has
approved.
identified and approved. And so we are implementing in November,
Okay.
all
And
things being equal.
so the recruitment process is ongoing right
Yes.
now.
Yes.
Okay.
Yes.
Now let me come back, because that's a key part. And how do you differentiate with the police? I mean, sometimes when people have a particular community they're working in, they can be territorial. What's going to be the collaboration between the two?
There has to be collaboration, Marlene. I think we're all fundamentally we're all about law enforcement, and the public health measures are legal measures, and so that there has to be close collaboration with the police. I mean, I am hopeful that there will not be incidences where we will need to call in the police, but that may very well arise. We know the nature of our country.
We could foresee that because resistance is usually the first thing.
Right.
When someone
there's a
sees you with
change.
your vest and they can say, but you're not a policeman. So
Yes.
they will automatically go against what you're trying to put in place. So I can't see where that individual, that member of the task force would not be able to call a police
to.
for backup or something,
Yeah.
because
It
it
has
will
to.
encounter a hostile situation.
It has to.
Yeah.
It has to. Fundamentally, the police is the backstop. The police is always the backstop, and so that the relationship has to be a very close one when it comes to the enforcement of these measures. You know.
And when you talk about going into the communities, definitely this will help with some of the rural spaces where they don't have a stationed police officer there.
Right.
Yeah.
Absolutely.
So let's talk about some of the specifics in the SI. I know there are the churches that are allowed to be open, businesses. Some businesses have different rules. Restaurants, for example, are only allowed fully vaccinated persons. A part of that was, of course, checking vaccination cards. You had a leak.
We had a leak
last week.
Unfortunately, we
Was
continue.
it a leak or a test?
No, it was a leak.
Okay.
It was a leak. It's still being tested.
Yeah.
And just for the public to understand, it is an app that is being created, that has been created. But before we can launch it, we need to get permission from Apple for people who have iPhones, and from Android for people who don't have the Apple phones. We have gotten permission from Apple for the app to be used, and I think that is where the leak. I think some people.
Yeah.
Jump the gun with it. And we're still waiting for the permission from Android to be able to launch. And as soon as that comes into effect, then we're going to do an official launch so that people understand how to use the app, and so that it also becomes available to business owners, so that it makes their life a bit easier, right? Now, on the back end of that, there's a back end of that. The back end of that is that at the Ministry of Health and Wellness, we are making sure that the data, your data, is inputted into the BHIS system, which will feed, which will be the source of the information. And so we have data entry clerks working around the clock, day to day, making sure that all the entries are inputted, so that when the time comes, your vaccination history will appear on that app.
Yeah. And that explains why some people who did attempt, like myself, didn't find their record there, because the vaccination cards are linked to the Belize health information system. So
That
you
is
have a
correct.
manual input taking place right now.
There is a manual input taking place, and a revision to make sure that all of the records have actually been inputted. Yes.
So that is to come on stream by when? Have you gotten an indicator by Android?
My best guess would be the 1st of November as well.
Okay.
That's my best guess.
Okay.
Yes.
So that helps in regulating or doing the checks at the restaurants. Because the concern is, well, we can't shrink our cards, and some people have integrity on doing it right. We always question the ones who will put us at risk.
Right.
But let's talk about the other implications under the SI, the rules that are being set for us to move forward.
Right. So I think, as you rightly indicated before, there has been a sort of a every 2 week or every month kind of plan in place, because simply we were measuring the amount of cases, the amount of deaths, and so we try to tweak the measures as we go along. The fact that we now have so many people in our country vaccinated, the fact that we need to now have some certainty, business people across this country need to be able to plan. The tourism industry, for example, who I think, who I want to salute, because I think these people have taken a major blow. We all have, but I think they especially. You know that with tourism, they need time. The airlines, the touring agents, they need time to plan. And so what we've done is we've come up with a 3-month plan, and we're basing it on our positivity rate. We are going to be having, I want to explain this in greater detail to the wider media, because I think it is just fair that everybody has the information. But I think the Prime Minister did indicate where we're going to go.
So 10% positivity rate at the end of this month, and we move the curfew back an hour.
Yes.
Any other changes that would come along with that change in curfew hour?
I think basically we're looking at one of the major changes would be the return of sports.
Okay.
Contact sports will be returned. As a matter of fact, as of the 20th of this month, non-contact competitive sports will be allowed with fully vaccinated people. And again, I think it is important to highlight, as more and more people become vaccinated, the benefits to vaccinated persons will increase.
Yeah,
right?
Like they may be able to travel across the border at the end of this year.
At the end of this year,
If the positivity rate.
If the positivity rate goes down to 5 or less, we are looking at perhaps a January reopening of our land borders. So again, the idea is twofold. It is intended to give certainty to the business community and to the tourism industry, and it is also intended to highlight to people how important your behavior is. You have a role to play in helping us to achieve these milestones. Your behavior will determine if we have a positivity rate of 5% or 10% or beyond that. And so the message is, work with us. It is everybody's problem. It is not just a government of Belize problem. It is every single Belizean who must take responsibility to help us to curb the spread of this pandemic.
And when you look at the positivity rate, the last data we showed was on Friday. We were at about 12.5 for that day.
Yes, for that day.
So it changes day to day.
It fluctuates. Like I said, it is based on the amount of tests being done per day, as well as the amount of positive arising out of those. And if I may just touch, because I realize...
Have we at any point in the past few weeks went lower than 12.5, or 12.5 is our lowest?
No, I think last week we went all the way down to 8.
Okay.
We've been seeing some 8. So that's positive for us. But I think an important thing we're implementing as of today, we are setting up... okay, let me backtrack. A couple weeks ago, 2 weeks ago, we started with 2 free testing sites. We set up one at the Civic, and we set up one at the parking lot across from the convention center, the Civic Center in Belmopan. So those are 2 free sites that anybody can go and get tested. We are now, as of today, opening 12 additional sites across the country, from Corozal down to Punta Gorda. We're opening new sites today where anyone can go and get tested. And I think that is important. It is important for us to know what our status is. As a ministry, for us, it is important to know the numbers for planning purposes. And so, again, as a courtesy of the government of Belize, we are now opening additional, I believe it is 12, across the country today. So you now have, again, easy access to free testing.
So the difference between accessing it at a public health clinic is that you need to be symptomatic or based on contact tracing. But if I wake up this morning just feeling a bit off, I can go to a free testing site.
You can go to a free testing site. The only people who are not going to be allowed to access these sites are people who are looking for tests to travel. For travel purposes, you must still access a private facility.
Yes.
But anybody else can access any of these testing sites.
Yes.
And that is across the country as of today.
Do you foresee, and I guess this question comes out of what we've seen happen recently in other countries within the Caribbean, where their respective governments have put forward to the people that come a certain time, those who are not vaccinated will essentially be on their own because we would have provided all the necessary resources for you guys to be able to do so. And so that when we decide to fully reopen the economy and to fully kind of take a step back from dealing with the pandemic only, then what becomes of you and your health situation in light of COVID will essentially fall on you, because we would have already done our part.
Yeah.
Do you think that we would probably get to a point where the government says, you know what, we've expended all our resources in trying to get people to be fully vaccinated, but the government has other equally important issues to be tackling? Do you foresee something like that happening?
Isani, what I can tell you is that we have to start to focus very soon on NCDs. They're affecting our people equally. We need to be able to refocus on opening up our hospitals again to provide other services to our people. And so as more and more people become vaccinated, as a Ministry of Health and Wellness, we need to expand the health services that we provide across this country. And I think you are going to be seeing that. You are going to be seeing that. We continue to push the vaccination. We will continue to push it as best as we can, and it will be a major feature for us. But eventually, it will no longer be the purpose of the Ministry of Health and Wellness, which has a larger mandate, which has a much larger mandate, and we need to move to that pretty soon.
All right, moving forward, and there's a lot more. I know there's a lot we can squeeze in into this time, but I do want to get some clear indicators as to what the plan is with booster shots. It's been approved by the World Health Organization, which I know we've used that as our guidance for high-risk populations.
So this is being discussed by NITAG, which is the national a vaccination team that we look at, and we are expecting recommendations from them on boosters. And depending on that, that will then go to the task force, which will review it. They will make recommendations, and I will put it forward to the cabinet for a final decision. I see it happening. Yeah. It is going to happen eventually. We continue to be concerned with people who have not received not even one vaccination. And that is always our priority. But I think the science is now showing that certain sectors of the community will require a booster. Yeah. And so as soon as that decision is made, we are going to be publicizing it.
Persons who've received Johnson & Johnson, the latest science is saying that they do require a booster.
Yes, we saw that. We saw that. But again, we take what is happening internationally and we try to bring it to a national level. We have the different institutions in place like NITAG and so on who look at these things for us and who make recommendations. We always want to follow what's happening internationally, but we also have to look at it from a national perspective. Yeah. And so that is the process we're going to be following.
Now, I know Baylor has trained our technicians to be able to do the genetic sequencing. Right. And I wanted to ask if we have been detecting any other strains. There are a few strains that have come out.
So far, no. So far, the dominant strain in Belize is the Delta, and we have not yet detected any new strains of the virus in Belize. I'll tell you, I'm very pleased with what is happening with that gene sequencing. Again, it is a major accomplishment. I know the two lab technicians who are trained have really become specialists in those areas. It gives our country an additional weapon. A research tool so that we know where we are in terms of what we're confronting as a nation. And so, you know, I really want to thank Baylor University, Baylor College for their continued efforts in Belize. Absolutely.
They've been very good with helping us. They're also doing a study on antibodies. And I wanted to ask, a lot of places in the world are looking at antibody tests. Have we approved any for Belize?
Not yet.
Is that in the plan to see how our vaccinations are holding out?
It'll come. We need to do it to see where we are in terms of the resistance that is being developed in the country. So it will come. It will come.
And lastly, there is a treatment that is in its final phases of testing.
Right.
As we know, when the vaccinations were being developed, it is very important to get in early with either a group of countries or a regional body to bid for access.
Yes, I am pleased to tell you, Marlene, that we've started conversations with the local Roche representative, and we are hoping to be able to sign up to get in line to be able to receive this pill when it actually gains approval and it becomes available on the market, it's going to be an additional weapon that we're going to be using to fight this pandemic.
What's the make or break for you when you look at the current situation in COVID-19?
Increased numbers of vaccinated persons. I don't think that we can sufficiently say how important that is. When we reach about 80% of the population that are eligible to be vaccinated, I think then we can really say we've reached an important milestone, you know.
Okay, so we do have some questions from our viewers very quickly, if you don't mind.
I don't mind.
We are going to do it as rapidly as possible, so once we get them up, you could just give us the shortened version of those questions. Churches are now open at 50% capacity. Is that the same with funeral and weddings?
No, they remain at 10. They remain at 10, yes.
persons.
They remain at
Okay,
10,
great.
yes.
Next up, when will borders be open back to normal?
Right, as we have said, if the positivity rate goes down to 5 or below, we are hoping that as of January, we'll be able to open our land borders.
Okay, this is a job, someone seeking the job here to be a part of the task force. How and where do you apply?
You please monitor our Facebook page. You should be able to shortly see the application form on there.
Oh, wow. Riding a bike, is the mask wearing mandatory? I have been charged for this.
Bicycle riding, no, it is not. It is a non-contact sport, and I think as well as with running, you're not required to wear a mask.
How long must you wait to get vaccinated after contracting COVID-19?
I believe that the current waiting time is 3 months.
Okay.
But please, if you have been infected with COVID, please seek advice from your medical practitioner. That is always the best way to go.
Oh, wait, go back with the question. Why is, okay.
We missed that one.
We
It went
missed
too
that
fast.
one, yeah. Why is it that when a person in a household tests positive, the others are also assumed to be positive by medical official and not tested?
Yeah, I think the understanding is that it is more than likely that the exposure of one person, more than likely everybody in the house would have been exposed, and so we treat everybody as being positive.
Is there any arrangement for policemen to patrol after the curfew hours to ensure people are compliant?
Well, I think the policemen are out there, and we've seen many incidents of ticketing for people after the curfew hour and for incidences happening that are a breach of the public health measures. So they are out there. We would want to see them more, but it is the reality.
The water taxi continues to fill up and people not wearing masks properly. Any thoughts on enforcement?
Yes, Mr. Montes, the idea, as I had said earlier, is that starting in November, we are going to have the COVID Enforcement Task Force who are going to be charged with this.
Do you have any cases of persons getting reinfected for a second time with COVID in Belize?
I am not aware of any. I'm not aware of any.
All right, that is the last question. That is a question.
I have one final
go
question
ahead.
to put to you.
Sure.
Seeing what these people are raising, my question is, you're not required to be able to present either a vaccine ID or a negative test result prior to being able to enter a public building. But if you've contracted COVID and you are within that 3-month period where you cannot take the vaccine,
Right.
what happens in that case?
You can get a medical exemption, a letter from the doctor indicating what was the period of your infection and when you were deemed to be clinically recovered, and so that would allow you to access.
All right. Well, we are out of time. There's always a lot of questions to ask. I'm sure we've probably missed some as well. But just taking the opportunity to talk to our viewers this morning. Minister, there are a mix of people, you know, the people who are very skeptical of whether the measures are enough. There are people who think they're too stringent. But fundamentally, I always say the same thing. Those numbers we report, those are real lives.
Right.
And those loss of lives, especially over 400 families.
Right.
It's a serious situation. So what do you say to people?
Yeah, you know, it is heartbreaking whenever we see anyone of our society, any member of our society die. If you stop and you look at the suffering these people go through once they're admitted to the hospitals, I think people need to stop and realize that once you enter the doors of the hospital, it is your There's no guarantee that you'll be able to walk out of there. As a government, it is our responsibility to put at the disposal of our people as much protection that we can. We have enforced these measures because we feel that this is the best way to protect our citizenry. We have gone beyond to make sure that we have the vaccines available to everyone in this country. It is your responsibility. It is each one of our responsibility to make sure that we are adhering to it to save our lives and to save the lives of our loved ones. There's only so much that your government can do for you. But as a citizen of this country, it is your personal responsibility to make sure that you and your loved ones are safe.
Well said.
All right. Thank you so much. And with that, we are going to go ahead and take a break. When we come back, we'll be joined by the young climate activist, Kiefer Miss, who's headed to COP26 in Scotland. Please stay tuned.
COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.